I'm Kay Brittenden. I'm Practice Manager at Bush Road Medical Centre. I have an enrolled population here of 11,500 patients. We have 9 doctors working from here, 30 staff, and so we're quite a big, busy practice. I was approached by Vensa about TXT2Remind about 2 years ago, and it took me about a year, 18 months before we did move to TXT2Remind, as I had quite a few worries at the time. Some of the worries were, or the concerns were, we had resistance from staff and doctors as to how this new technology was going to work. I was concerned about patients, especially our elderly patients. Would they find a cell phone message intrusive? Would it go to the right person? People swap cell phones all the time. We weren't sure how that was going to work. I had concerns around privacy issues and consent, how we were going to do that. I had a few concerns about ongoing costs and how it would be used amongst the staff, and if everybody was sending out TXT2Remind messages to patients, how would I keep a control, I guess, on the budget. So those were my main concerns. After negotiating with Vensa, they assisted me on a broadcast message that went out to all of our patients. One of the other concerns that I need to mention is I wasn't sure how clean my data was. Were the cell phones up to date? And so that first broadcast message, we actually sent out 4,500 messages and received 2,500 back. The software was actually capable of telling us who received and who didn't receive the message, so that covered a lot of my concerns about who had cell phones, etc. That first message, I had asked people to reply to the message yes, no, where they consent to using TXT2Remind. And so now we actually use the product, but we don't ask for a reply. So the other concern I had was how would some of our medical staff take to it that weren't going to embrace it, and they have started to use that. So the benefits the doctors have found now, instead of sending an inbox message to the nurse's inbox after reading it, say a normal test result, they will send a TXT2Remind message straight to the patient to say your results were normal, and that's done. So it's instant, and it means that the nurse is free to do other jobs. So from that point of view, it's really great. For all our health promotion targets that are happening through the PHO up here, we send out a lot of our recall letters through MedTech, and so that's working really well. Again, budget-wise, it saves on paper, letters, envelopes, people that are stuffing the envelopes and posting their mail out. So it's very economical from our point of view and working well. The patients have embraced it. Those that do use the new technology, it's great. Those that said no, they'll still get a letter, so they're happy. It was a great way of tidying up our database, and so we've been very happy. We've been using the product now for a couple of months. I'm picking it'll take 6 months before we get the full benefit of it. That's just because we are a big practice. We tend to, new things take a while to seep through our systems. But for anybody that is interested, give me a ring. I'm quite happy to talk to people and their different concerns. Thank you.